The first set of muscles we're discussing is quite a complex group of muscles which have been grouped together to be called the Erector Spinae. And Erector Spinae in Latin means the muscles that keep you erect, keep the spine erect. Now, the way they work is very interesting. They are a set of muscles that start from deep, and when they're deep, they run across just one level, and the deepest muscles are called the Multifidi. Very small little muscles, and they stabilize each segment. Then the next set of muscles run across two segments, so you can see they start almost horizontal, then they gradually becoming more vertical. The next lot are called the Semi-Spinalis. So the Semi-Spinalis cervicus for the neck, Thoracus for the thoracic spine, and Semi-Spinalis for the lumbar spine. So this set of muscles are, as I say, they're slightly more vertical, running across two and sometimes three segments. And then you have another set of muscles which are now much more vertical. And there are two parallel sets. The first are called the Longissimus, which in Latin means the longest muscles. And they start right down here at an area which glues the spine together, called the Thoraco lumbar fascia. So it's a big, strong, fibrous band shaped like a rhomboid, like that. And these arise off that and off the edge of the iliac crest, and then they run up just vertically, and they run from these spines, running more vertically down the spine and ending up in this thoracolumbar fascia. And then there's a second parallel group which is called Iliocostalis, and this arrives, ilio is the iliac crest, running vertically up and attaching to the ribs as they go up. And that's where the costalis part comes from. So these muscles, basically what they do is they stabilize each segment, that's the Multifidi, and then gradually as they move, as they become more superficial, they become more muscles which extend your spine. And if you take, as they become more lateral, they become muscles which extend and rotate your spine. So a very complex set of muscles, and where they live is in a mass on each side of the spine. Okay, so now we're going to look at where you find these muscles in somebody's body. And if you look down here, these two little dimples, they overlie the posterior superior iliac crest. So the iliac crest begins here, and you can feel as it runs along. I'm going to draw it, and it comes round like that. And what we're going to draw is the posterior spine. So here is the sacrum, carries on down like that, and then you can feel the little posterior spines as they come up, and here. So that would be L5, 4, 3, 2, and upwards. The Erector Spinae sit close to the posterior spines, and they make up this mass of muscle. So the Erector Spinae in this case are the Multifidi, the deepest, the Semi-Spinalis, and the Longissimus, which arises from here and runs more vertically up the spine. The the Iliocostalis arise from here, and they run up the spine like that, and they give little branches to the ribs. So here's the 12th rib here, there's the 12th rib, and the Iliocostalis arises from here, runs up like that, and then will give a little branch to here, to the next rib, and so the muscle's running along like that, slightly away from the first mass, the large mass of muscle, which is the original Erector Spinae. When you get triggers in the Erector Spinae, they tend to be local, and so your pain will be just where the trigger occurs and may refer slightly laterally, like this, but not a long way. And there are some oddities that occur with the especially the Iliocostalis, where you may have triggers in the lowest Iliocostalis, so that's where the 12th, 11th and 10th ribs are, and they can be perceived down here, and the Iliocostalis at the top will, if they're in the upper thoracic area, will refer up into the neck. But otherwise, the large mass of triggers in the Erector Spinae are local and refer only slightly out to the side, which gives you an idea. So somebody who is very uncomfortable, and you then and they're pointing at a localized area, you're quite confident. You can be quite confident that and it's close to the spine, arising in here. You'll be quite confident that there will be trigger points in the Erector Spinae muscles. So the way you find the triggers, now this is tricky, because normally the principle is that you say you have a longitudinal muscle, you run across the long axis of the fibers to feel for a tight band, and then you move up and down the tight band until you find the trigger. So for Iliocostalis out here, that's what you can do. You can run like this. You feel that there's you'll feel it, and you'll feel it like a little guitar string. You find it, and then you move up and down, and the person will say, that's, and you'll feel a little swelling. Once you find the swelling, you can treat it. As you come down here, then it becomes a little bit more tricky, because the fibers, the deep fibers, are running almost that direction. The more superficial fibers are running like that. So my practice is that what I do is I kind of move in an arc, running across what would be horizontal, more 45 degrees, and vertical. I'm running in an arc like this, feeling for a band. Once I feel the band, and it may be difficult with the deep muscle because it's quite small, and I can feel a thickening, then I focus in. So let's just talk about how to treat the trigger. And the way you treat the trigger is using, there are a number of options, but the simplest is to use the ischemic pressure principle. So you find the trigger, and if you've got somebody with a very big, very strong back, you may need your thumb, or you could use your finger. I always help one finger with the other, and may use both hands, but this finger is doing the work. I find the point, I press hard enough, I ask my patient, is that the sore point? He'll say yes or no. Once I've found it, I reduce the pressure enough so that there is no pain, but I can still, with a little bit of movement, if I press in, it'll be uncomfortable, and I also feel the nodule under my finger. Once I get the pressure just right, he's comfortable, then we both just breathe and relax and breathe and relax, and gradually I increase the pressure and I say, tell me if it hurts. And usually over 90 seconds the nodule melts away, he has no pain, I'm able to push hard as I like, and then it's gone. So that's treating the triggers of Multifidi, Semi-Spinalis, Longissimus, and Iliocostalis. All of these you can treat. The other way, which is actually pretty effective, is to use a cold pack, just a standard pack that you would find, that you would use in a freezer or in a cold pack when you go on a picnic. So it needs to be fairly cold. The principle is that you start at the origin and you go to the insertion, and then you move on into the pain reference zone. So for these, it's fairly simple because it's going to be a short movement. But again, your difficulty was you don't know where the origin and the insertion of the muscle is. So what I tend to do is, because of the different angles, if you actually were able to feel a band, then you would know which way to go quite clearly. But if you can't feel a band, you just found a tender area, then I would start here, which is the origin, and I would run across like that. I would run across in the kind of rate, it's at this rate, just like that. And if you're down here, vertical. So again, I've gone that way, this way, and that way, and I would do 2 runs just like that. And what the cold does is it kind of immobilizes the trigger point by giving it a big input of freezing cold. And really that's what you're trying to do, is immobilize the trigger point. Now to stretch, which is the next part, the ability to stretch these muscles, what you do, the muscles themselves, as they contract, would tend to shorten and rotate and extend in that way. So what you need to do is exactly the opposite. So you bring the shoulder forward, you bring the hip back, and you use your hand to stretch. A simple way to do this is the kind of movement that you would do if you were doing a lumbar manipulation. So if I just show here, I would lean my elbow here, and this elbow would be pushing in that direction. No, stay like that, thanks. And then this hand would be going the opposite way. So like that. So I'm pushing this away from me, I'm pulling this part towards me, and I'm stretching these muscles. So the way that you do your stretch in the most efficient manner is to time it with breathing. So as we did, so if we say we had a trigger just here, you can stretch it like that, but it's better to use his body as a lever. So we go this way. So as I said, I would tend to use my elbow, and I would tend to use my hand on the other way. I'm stretching down into here, and then I would say, take a deep breath in. So he breathes in, count 6, 2, 3, 4, 5, 6, breathe out. And then you keep counting in your head, 7, 8, 9, 10, 11, and what will happen is that this area will just stretch in that post-isometric relaxation, the wonderful neuromuscular that occurs, the effect that occurs right throughout your body. And then you apply a heat bag, and this is just a wheat bag with a fancy green cover, and you put this in a microwave, you apply it, you leave it on. So I would do it in this way. You leave it on for 5 to 10 minutes, and at the end of that time, when you take it off, the back should be nice and red, and then you do another stretch. Or he does another stretch like that. Very good.